This side event has been co-sponsored by the Permanent Mission of Costa Rica and the International Physicians for the Prevention of Nuclear War. I'm Dr. Sally Ndongo, IPPNW Kenya member and member of board at large IPPNW. We are gathered here today on the margins of the second meeting of state parties to the TPNW, a true beacon of hope during an incredibly bleak and dangerous moment. With two violent wars involving nuclear armed states, faltering international norms, escalating climate crisis, and rampant inequality, we have no other option but to act boldly and meet the needs of the moment. As a federation of physicians and a coalition of the world's largest health organizations, we are joined here today with one common message: nuclear weapons pose the most acute risk to human and planetary health. Without further ado, I'd like to welcome Ambassador Maritza Chan. Ambassador Chan is a Costa Rican career diplomat, academic, and activist. She is the first Costa Rican woman to occupy the role since Costa Rica signed the UN Charter in 1945. Before her appointment, Maritza Chan served as Ambassador, Deputy Permanent Representative of Costa Rica to the United Nations from March 2020 up to August 2022. She is a true champion of nuclear disarmament, committing personal and professional time to advancing the elimination of nuclear weapons. Welcome, Ambassador
Thank you
Chan.
so much. And I thank you all for being here today. I know we have had a very productive event and discussion at the plenary, but whoever is here, it's because they care, and we need more of you. We need more of you because there's so much pessimism around the world, and the TPNW it's a ray of light in these dark times. I want to thank the IPPNW for organizing this event, which we are delighted to co-sponsor, and thank the International Council of Nurses, the World Federation of Public Health Associations, the International Committee of the Red Cross, my partner in peace, the World Medical Association, and the World Federation of Medical Students Association for sharing their message with us today and for participating in this panel. I represent a country that has made humanitarian disarmament a state policy that is committed to strengthening the rule of law as the only legitimate means of relationship between states. We are a demilitarized country with a long-standing democratic culture, and we understand the importance of science in democracy. A fact-based approach undergirds humanitarian disarmament, and thus it is a role of states, especially TPNW states, to promote science. Healthcare experts have been crucial in driving the humanitarian impact of nuclear weapons, and healthcare expertise and focus must remain central to all advocacy and campaigning efforts oriented at nuclear abolition. The evidence-based approach from a medical standpoint is a powerful and compelling message that is capable of changing the dominant narrative. It led the world leaders to acknowledge by the end of the Cold War that a nuclear war can never be fought and can never be won and must never be fought. And is leading the world to support nuclear abolition in ever greater numbers. Moreover, the selfless concern for the well-being of our fellow humans inherent to all healthcare workers and endeavors, coupled with an evidence-based approach, will ultimately lead to the elimination of nuclear weapons, and I hope that we'll get to see that day. I commend the organizations here today for your commitment and for your work. I commend you for your activism and for the important role you continue to play. Your place is here at the UN, at every political arena where nuclear weapons are discussed. Nothing about us without us. A clear understanding by diplomats and policymakers is crucial for people to be rightfully placed at the center of all discussions regarding nuclear weapons. You need to be here. We need you here. The objective understanding provided by the scientific rigor is the best way to protect life and advance humankind, and I would say policymaking here at the UN. Science is on the side of those fighting for nuclear abolition. The momentum that led to the TPNW was born out of the scientific and evidence-based understanding that the only way to avoid the horrific consequences of nuclear war is to eliminate nuclear weapons. The TPNW is the result of policymakers listening to the evidence presented by the 3 international conferences of the humanitarian impact of nuclear weapons and then taking action. The political action materialized in the process leading to the negotiations of the treaty. And this evidentiary support was key to the conception and birth of the TPNW, and it will be an essential component to its universalization. My dear friends, the weight of science will bring down the nuclear hegemony. And I please you to continue working with your knowledge, resources, and expertise towards this novel cause, for science must continue to be the driving force behind nuclear abolition. I thank you, and let's continue. We are not done yet. Thank you.
Thank you so much, Ms. for your opening remarks and dedication to our work. Indeed, a nuclear war cannot be won and must therefore never be fought. Next up, I'm pleased to welcome Veronique Christori to the floor. Veronique is the Senior Arms Advisor for the International Committee for the Red Cross, delegation to the United Nations. Since 1997, she promotes and develops laws regulating the use of weapons, including conventional and nuclear weapons, as well as new technologies such as autonomous weapon systems and cyber warfare. She also partook in a demining course in Cambodia. She participated in all the negotiations related to the weapons issues at the UN in the last 2 decades, notably the Arms Trade Treaty in 2013, the Non-Proliferation Treaty Review Conferences, as well as the Treaty for the Prohibition of Nuclear Weapons. She is the proud mother of 4 children. Veronique, the floor is yours.
Thank you very much. Good afternoon to all. I'm truly delighted to be with you, and thank you again for the invitation. 70 years ago, doctors and nurses like some of you, the Japanese Red Cross and the ICRC witnessed firsthand the horror and suffering brought upon Hiroshima and Nagasaki when the atomic bombs were unleashed. ICRC Dr. Marcel Junot was the first foreign doctor to reach Hiroshima after the atomic bomb to treat some of the victims. With others, they tried in near impossible conditions to assist the dying and injured. Hospitals were in rooms. There were no medicine, no bandage, no blood transfusion. In the awful hygiene conditions resulting from the heat and the lack of drinking water, wounds became infected and disease began to spread. As Dr. Junot recounted in his notes, out of 1,000 patients who had taken refuge to Hiroshima Red Cross Hospital on the first day, 600 died. He also underscored the consequences of the bomb for Hiroshima Medical Corps. Out of 300 doctors, 270 died or were injured. Out of 1,700 nurses, 1,654 perished or were injured in the first week. 80% of the doctors and 90% of the nurses were killed in Nagasaki. Dr. Junot wrote, I quote, "The physical impact of the bomb was beyond belief, beyond all apprehension, beyond imagination. Its moral impact was appalling." He ends his journal with reflection of a scientific and medical nature, and with an appeal for the bomb to be banned outright, just as poison gas was outlawed in the aftermath of the World War I. And then, since 1945, I mean, the ICRC made the first call in September 1945 to prohibit and eliminate nuclear weapons. So it took a very long time. But we are delighted that in 2017, the Treaty on the Prohibition of Nuclear Weapon was an answer to this call. 7 decades on, we bear witness to the long-term effect of nuclear weapon use and testing, including their gendered impact. Women and girls are more and differentially affected by ionized radiation. As we speak, the Japanese Red Cross Hospital and the Japanese government continue to treat daily many thousands of victims of cancer and other incurable illness caused by the radiation. First and second generation of survivors of nuclear weapon use and tests are with us at the MSP. We pay tribute to them. Their presence, testimonies, and action and determination are of utmost importance. And a couple of weeks ago, one of the youth from Japan that is part of the ICRC delegation had a conversation with Nibakusha, and it took her 70 years to decide to speak. And she said that she really thinks that it was thanks, she recognized Dr. Junot on the picture, and she said that it was thanks to him and the medical help that he was able to secure, and giving her vitamins and some medication, that she was able to speak 70 years later. But I mean, the mental and psychological trauma took really 70 years to be able to speak about it. So it's so important to continue to hear testimonies, but because they will not be able to share the horror of the impact. So we really need to continue on this part. Today, there is no international plan, no capacity to respond to the humanitarian consequences of a nuclear confrontation, which could lead to the death of millions of people, climate change, and global famine. So what we cannot respond to, we must prevent. We need to speak out. As first responder, as doctor, as nurse, we deliberately, if there is a use of a nuclear weapon, deliberately or by accident, I mean, you will be in charge to respond and not to discuss the politics if it was deliberate or not, if nuclear deterrence work or not, because de facto it will not work. So it's really critical to refocus the debate on what nuclear weapon use will mean for civilian and combatant and for the natural environment in which we all depend. The existence of nuclear weapons poses some of the most profound questions about the extent of human suffering we are willing to inflict or to permit in war. And I think that this question is at the heart of our conversation. The TPNW is a beacon of hope. It shows that the impossible is possible, a world free from this weapon, a treaty that puts people on the planet not only at the center of the debate, but at the core of our collective action, the raison d'etre of the treaty. And then Article 6 on victim assistance and 7 on environmental remediation are essential for achieving the treaty's humanitarian objective. The ICRC published a detailed briefing note with guidance on the interpretation of dispositive obligation to support those who work on their implementation. It's a very important tool. It's a collective effort toward the implementation of Article 6 and 7 from very different fields, from the science, the medical, the humanitarian, social study, mental health. It's really key. In June 2022, also, the Red Cross and the Red Crescent movement adopted an ambitious new resolution on nuclear weapons and an action plan to support the Red Cross and Red Cross families' action toward the elimination of nuclear weapons in the next 6 years. Let's see. And then in the action plan, what is important that it promotes and encourages studies on the gender impact of nuclear weapon, on new study that states, even they are not party to the TPNW, can engage, finance, and promote among young generation. Prevention is the only cure, as is the excellent title of the side event. Thank you for contributing to much needed public health case for nuclear disarmament for today and for the sake of future generations. So thank you very much.
Thank you so much, Veronique. Very wise words there. And indeed, TPNW is a beacon of hope that really brings out the possibility where things seem to be impossible. So we'll move on to our next speaker. And our next speaker is an online participant, Dr. Jill Adinsky, Nursing and Health Policy Analyst with the International Council of Nurses. Dr. Jill is a nurse researcher with expertise in global health workforce, health policy, and health system strengthening. With the International Council of Nurses, she has worked on gender equity, climate change, student groups, and other nursing policy topics. She completed her doctoral education at the University of North Carolina at Chapel Hill through the Hillman Scholars Program in Nursing Innovation. Their dissertation focused on nurse staffing and nurses' attitudes towards their job relationship with HIV outcomes in rural health facilities in northern Namibia. Jill has served as a nursing and health policy analyst at ICN since June 2022. Welcome.
Hi, thank you for that great introduction. So I am speaking to you all today on behalf of the International Council of Nurses on why nurses believe that it is so important to have nuclear weapon disarmament. Before I begin, I would just like to take a minute to thank not only all of you for coming and listening to us talk today, but also for Costa Rica and IPPNW for hosting this event. For those of you that don't know, the International Council of Nurses is a federation of more than 130 national nurses associations worldwide. We're a longstanding organization dating back to 1899, and we have members of about 28 million nurses from all over the world. We are the first and the widest reaching international organization of health professionals. Throughout all of our history, our organization brings together nurses from all over the world, and we bring together nurses, especially in times of war, to unite and advocate for health, well-being, and peace. We strongly believe in nuclear weapon disarmament. We believe in prohibition and elimination of nuclear weapons, and that is the only response and proper course of action in the face of dire consequences. As we know, there's a variety of different health impacts of nuclear weapons. We've heard already that they can wipe out entire populations. They cause direct trauma and injuries at the time of the attack. They have long-term radiation sicknesses and generations that can last, and long-term genetic damages that can last generations. We know they can cause a variety of different mental health impacts as well. And I want to mention that these damages can be specifically to the health workforces as well. After the bombing of Hiroshima in 1945, we know that many nurses lost consciousness and suffered injuries themselves before getting up and caring for others with radiation sickness. When interviewing those nurses, we know that many of them didn't expect to survive themselves, but despite that, they continued providing care to those around them. Through these stories from nurses in the time of war, we know that these same nurses call for the prohibition of nuclear weapons. And we know that we can see the impacts for generations to come from these nurses who cared for those in Hiroshima. The ICN currently has a campaign to call for peace for all around the world. The Nurses for Peace campaign was born out of the desire for nurses to show solidarity and support for those colleagues working in conflict zones. This is a response which has a humanitarian response to nurses dealing with all sorts of natural and human-made disasters. This campaign provides direct financial support to nurses, specifically food and basic supplies and training. The ICN also strongly supports the Not a Target campaign, which many of you may know calls for avoiding healthcare facilities at all costs in conflicts. I want to remind you all that nurses are peacemakers. As Ms. Veronique just reminded us, that women and girls may experience differing effects from nuclear attacks than others. Specifically, there's the nursing workforce, which we know is made up of 90% women. This means that they'll be on the front lines of caring for people in the event of an attack. It's so important to protect these healthcare workers because that also is an issue of gender equity. Furthermore, there's a growing body of evidence showing that women's participation in peace talks and peace agreements contributes to the elimination and durability of peace agreements. I'll take this opportunity to remind you all of our profession of nurses, who again are made up of 90% women, and believe in peace and health and well-being for all. It's critical to include nurses in discussions about peace and weapon disarmament. I'd like to leave you all with 4 key takeaways. First and foremost, nurses call for the prevention and prohibition of nuclear weapons. Next, we need to make sure that we include nurses as voices in all disaster preparedness talks. Finally, I would like to remind you all that nurses are leaders of peace and well-being around the world. And if we fail to prohibit nuclear weapons, war and conflict in general, then we'll have impact on health and well-being for generations to come. Thank you all for having the nurses come and speak with you all today. And you can reach us at ICN Nurses if you have any further questions. Thank you.
Thank you so much, Jill, for your remarks. Indeed, the role of nurses cannot be understated. Next, we shall hear from a medical student, Ana Maria Dragu. She studies at Carol Davila University of Medicine and Pharmacy. Currently, she is serving as IFMSA's liaison officer for human rights and peace issues. Her main areas of interest are nuclear disarmament and the intersection between peace, health, and migration. Welcome, Ana Maria.
Thank you so much for the introductions. Dear ladies and gentlemen, dear colleagues, first I would like to start by thanking our colleagues from IPPNW and the Permanent Mission of Costa Rica for the invitation to this panel. And I would like to start my intervention with a question for all of you present here, and the question that I have been asked a couple of times by my colleagues. Have you ever stopped to ponder the role that medical students play in the task of advocating for the banning of nuclear weapons? To answer this question, let me share a personal perspective. Growing up in Romania, I witnessed the impact of nuclear disasters through the lens of my parents' experience in a world where the Chernobyl nuclear power plant disaster happened. They lived through the aftermath, and the effects were not confined to the physical scars on the landscape, but left lasting impressions on the health and well-being of the affected communities. Now, let's consider the broader picture. With rising political tension and sharp nuclear rhetorics, the world faces several challenges in its approach to the world's nuclear arsenal. Threats to peace not only have geopolitical consequences, but also directly undermine individual and public health. Young people, comprising more than 1.8 billion of the total world population, play a pivotal role in shaping our collective future. Among them, an estimated 400 to 600 millions live in violent and conflict-affected areas. It is within this context that I firmly believe it is our role as medical students to become the architects for a safe and healthier world, not just witnesses within the process. Maybe the linkage still sounds a bit absurd, but to answer this question, we need to think about the core responsibilities of healthcare professionals to heal. And sometimes prevention is healing, since in the case of nuclear weapons, they produce scars that we can't cure. We've seen firsthand the impact on individuals and communities, not just physically, but psychologically. Consider for a moment the far-reaching consequences of nuclear conflict. It's not just immediate physical injuries that concern us, but also the lasting trauma, the psychological scars that impact individuals and entire communities for generations. As future healthcare professionals, we understand the importance of preventative medicine, and advocating for the elimination of nuclear weapons is the ultimate preventative measure against a catastrophe we cannot treat. In addition to the horrific impact of using nuclear weapons and the lasting psychological trauma, there are long-lasting effects on of the attack. An increase in the incidence of radiation-caused cancer might be noted many years after exposure. Among chronic impacts on atomic bomb survivors, the most lethal is leukemia. As we talked about my country, Romania, it was shown in multiple studies that post-Chernobyl, the incidence of thyroid cancer increased over time. Moreover, it's crucial to acknowledge that medical education is pivotal to capacitate health professionals to actively promote and uphold peace through their practice. Until recently, peace and peace building have been neglected in medical curricula, as it is mainly based on disease-based learning. However, as conflicts arise on a global level and we live through a fragile political situation nowadays, the need to systematically address this issue on a university level becomes apparent. Human rights education in medical curricula helps build the necessary capacities in medical students to promote and safeguard peace by upholding human rights and deconstructing systems of abuses. This can prove to be an effective adjunct to international political efforts. After all, knowledge is power, and the more we as youth and as future healthcare professionals get involved, the more these policies will reflect our needs. In conclusion, let us embrace our role as advocates for a safer world, drawing inspiration from personal experiences and the collective histories of our communities. With the world facing challenges in its approach to nuclear arsenals, recognizing that threats to peace undermine individual and public health, and understanding the pivotal role of medical education in promoting peace, our actions today echo across the years, influencing not just our time, but the times that follow. Together, let us be the architects of a future free from the scars of nuclear weapons, paving the way for healing and well-being for generations to come. Thank you so much.
Thank you so much, Ana Maria, for your words and for your time, you and other medical students and young activists, the work you do in ensuring that we eventually get to a nuclear weapon-free world amidst your very busy schedule. Thank you so much. We shall now hear from our next speaker. And this is a pre-recorded video. The Executive Director of the World Federation of Public Health Associations, Bettina Borish. Dr. Borish is an MD and histopathologist. She has a master's in public health and is a fellow of the Royal College of Pathology, UK. Her scientific research work delves into neoplastic lesions of the immune system and breast cancer. Her interests also include community-based oncology, health communication, and global health.
Thank you for having me. Prevention is the only cure. Public health case for nuclear is disarmament. I want to propose that we talk a little bit about geopolitics. My name is Bettina Borish. I'm the CEO of the World Federation of Public Health Associations. We represent over 5 million public health professionals, advocates, and fanatics all around the world. When we say geopolitics, what does it mean? The academic definition tells us geopolitics is the study of how the projection of power, may it be military, cultural, or other, is effected and affected by the geographic and political landscape in which it operates. But if you look further, what comes up under geopolitics, you will see mainly economics, a lot about business, risk evaluation, strategies, power relations, very little about health. But in today's world, wasn't there health already in it? Didn't COVID pandemic play a role? I think that yes, the decision for a pandemic treaty or convention that is negotiated now at WHO, among others, was made from the understanding that health is linked to destabilization, security, international relations, in addition to the more technical aspects of the pandemic. But if we look at how the negotiations at WHO with the intergovernmental negotiating body go on, we have to say that more and more the geopolitical tensions that are increasing influence the discussion of health. And we have talked about multiple crises, polycrisis, and we see that this situation with multiple crises leads to different aspects. People, individuals fear and are anxious because they feel uncertainty. That leads to polarization between nations, but also in the whole world community now. There are political movements coming up that favor always the conflict instead of the solution. And this all leads to what we have seen in COVID and everywhere else, a loss of trust. There has been also, and there is, a kind of silent battle of political systems. You remember the beginning of COVID, a bit autocratic versus democratic. So the question is also, what political system favors global health, favors the solution, favors negotiation among and within countries? The clear answer is, and studies have proven, both health and peaceful living are favored by democracies. But the bad news is that today, the global state of democracy is declining. More countries, as you see on this graph here in pink, are declining if it comes to the state of democracy. That means free journalism, access to good judgments, and so forth. So my key message for all of us: to prevent wars and other man-made disasters, global health diplomacy has to include peace building, and we all, as civil society, as citizens, have to protect or build or enforce strong democratic societies. And not unlike prevention that we teach and preach in public health, the prevention of war starts with creating the determinants that favor health instead of disease and peace instead of war. Thank you very much.
Thank you. We're so grateful to have the support of the Public Health Association through the participation of Bettina Borish, even if she was not able to join us physically or virtually. Next, we are privileged to hear from the President of the World Medical Association, Dr. Lujane Al-Kodmani. Dr. Lujane is also the Director of Global Action and Project Portfolio at EAT and a member of EAT's senior leadership. She was not able to join us as she is currently on maternity leave. She is responsible for implementation of EAT's strategic goals, oversees all EAT's projects, and measures the overall organizational impact. Lujane has a background in global health and medicine. Prior to joining EAT, she worked in various positions, including serving as an emergency physician in Kuwait.
Ladies and gentlemen, esteemed colleagues, and fellow advocates for a safer and healthier world, I'm honored to stand before you today virtually, and apologies for not being with you in person. I'm standing before you representing the World Medical Association, a global collective of over 10 million physicians, united in our resolute pursuit of a world free from the haunting nightmare of nuclear weapons. Our call is not just a clarion call, it's an urgent plea that transcends borders, political ideologies, and generations. A plea for nuclear disarmament and the preservation of humanity's health, prosperity, and future. As physicians, we are entrusted with a sacred duty, the sanctity of life and the preservation of health. Through the World Medical Association, we rally alongside our partners, united in our unwavering advocacy for the complete eradication of the nuclear armament from our world. Contemplating the annals of history, the grim specter of the nuclear bombings in Hiroshima and Nagasaki cast a haunting shadow over our collective consciousness. Over 300,000 lives perished in a flash, and countless more bear the enduring scars of suffering and unimaginable health consequences. These tragic events are enduring reminders of the catastrophic toll nuclear conflict exacts on humanity's health, leaving a legacy of pain etched into our history. Yet, despite these hard lessons etched in our past, our world is gripped by escalating tensions, hovering precautiously on the precipice of resurgence in nuclear hostilities. But we, as physicians and healthcare professionals, say no more, not now and not ever. In this precautious juncture, the Treaty on the Prohibition of Nuclear Weapons stands as an unparalleled bastion of hope, a beacon guiding us towards a safer, healthier future. This legally binding instrument is not just a symbol, it's a lifeline that intersects directly with the safety, health, and well-being of every individual of this planet. We salute the 69 nations that have ratified and embraced this pivotal treaty, a testament to their unwavering commitment to a safer world. Yet, our impassioned plea resonates louder than ever. We implore every remaining nation to expeditiously and urgently ratify this legally binding treaty. Our vision is crystal clear: a world emancipated from the ominous specter of nuclear weapons, a world where health and peace intertwine to nurture a prosperous and secure future for humanity. Physicians stand at the vanguard of humanity's well-being, and today we issue an equivocal call to action. On the occasion of the second meeting of states parties of the Treaty on the Prohibition of Nuclear Weapons, we beseech governments, global leaders, and policymakers to seize this historic moment, champion the cause of peace, health, and security. Let us forge ahead, united in purpose, striving unwaveringly towards the world where the threats of nuclear warfare are relegated to history's darkest chapters. We are now committed more than ever, and we continue to stand together with our partners, IPPNW, IPMSA, WFPHA, RCRC, and ICM, and call for all parties to ratify the treaty and be a legacy of resilience, courage, and unity, a legacy that safeguards the health and prosperity of generations to come. For in this pursuit, we not only secure the health and future of our world, but also reserve the very essence of our shared humanity. Nuclear weapons, no more, not now, not ever. Thank you.
Wow, what a strong voice from the medical community, and a very good punchline for us as medical professionals to use. Not now, no more, not now, and not ever. Last but not least, we have Dr. Carlos Umana, co-president of IPPNW. Dr. Umana is a general practitioner, former local health director, and epidemiological surveillance officer with the Costa Rican Ministry of Health. Serving as IPPNW co-president, he also sits on the ICANN International Steering Group. He is the current president of IPPNW Costa Rica, founder of Artists for Peace 2014 in Costa Rica, and president of the activist group Peace and Diversity. He is also the recipient of the 2018 Alan Turing LGBTQ Visibility Award for Social Organization. Carlos, welcome. The floor is yours.
Thank you, Sally. Aside from being the only man in the panel, which is a good thing, yes. Yeah, that is intentional. We are feminism is part of progression and part of democracy, inclusion. I'm also, as you heard, a very proud Costa Rican, and I'm proud because I come from a country that gave up its army, and a country whose government officials recognize the importance of civil society, the importance of science. Ambassador Chan has been a champion and a close friend throughout many years working in this cause. I'm also quite happy and quite proud at this event. This event is a testament to an ever-growing partnership of health-based organizations. This not only signifies the strength of scientific diplomacy, it also signifies the ever-growing strength of the evidence-based approach. And it's this evidence-based approach that we need to eliminate nuclear weapons and to get peace. So let me start by talking a little bit about my organization, IPPNW, this very short acronym that not everybody knows is International Physicians for the Prevention of Nuclear War, medical doctors. We are a federation that mobilizes medical doctors, students, and concerned people in 60 countries that aims to work towards a more peaceful and secure world free from the threat of nuclear annihilation. We are the only international medical organization that is dedicated to the abolition of nuclear weapons. And in practical terms, this means participating in organizing forums, lectures, publishing papers, op-eds, meeting with government officials, participating in campaigning, and doing scientific diplomacy. IPPNW was founded by US and then Soviet physicians in 1980 with the purpose of raising public awareness about the devastating effects of nuclear weapons. And these physicians were credited with persuading American and Soviet leaders that the Cold War arms race was jeopardizing the survival of the entire world. IPPNW received the 1985 Nobel Peace Prize for, I quote, spreading authoritative information and creating awareness of the catastrophic consequences of nuclear war. And that basically sums up our work, evidence-based policymaking from a medical perspective. This means placing science at the service of the people and the people at the center of all discussions regarding nuclear weapons. And let me talk a little bit about this, because the current context is incredibly concerning. And we agree with experts that say that the risk of a nuclear war is very high right now, and perhaps the highest it has ever been. Now, let me break down what I mean by this. As you heard by our colleagues, especially by the presentation made by dear friend Veronique, we heard about what would be the consequences of one detonation, what happened in Hiroshima and Nagasaki. Nuclear weapons are, of course, made to target civilians, non-combatant women, elderly, and children. These are the people that would suffer the atrocious effects of radiation, the breakdown of their vital organs and tissues. These are the people whose eyes would melt, whose faces would melt, whose abdomens would explode. That's what nuclear weapons are for. That's who they are targeting. They're not targeting military objectives, but civilians. Now, what we heard was one detonation, but if we're talking about a full-scale nuclear war, we're not talking about one or two detonations. We're talking about several nuclear weapons in several cities. This would immediately cause tens of millions of deaths and hundreds of millions of injured people. There would also be an enormous environmental devastation, not only because of the massive destruction and the large amounts of radiation that would be spread globally, but also because of the large amount of soot and debris that would rise to the stratosphere. The stratosphere is a part of the atmosphere that cannot be washed by precipitation. And this would cause a significant block of sunlight that would lead to a swift and drastic drop in the global temperature, producing a nuclear winter that could last for several years. Now, because many food chains would not be able to survive the drastic cooling and the prolonged lack of sunlight, this would be devastating for many ecosystems and many species. In other words, a full-scale nuclear war has the potential of wiping out our civilization and possibly even our species. So what is the risk of this happening? Today, about 2,000 nuclear warheads remain on high alert. That is, they are ready to be detonated within minutes. And these high alert systems, which are increasingly dependent on automated systems, are vulnerable to cyber attacks, to technical error and human error, and have been triggered by false alarms such as flocks of geese or storm clouds. There have been many, many accidents with nuclear arsenals, and we publicly know of 6 occasions when the world has been on the verge of a full-scale nuclear war by accident. Now we are in wars where explicit nuclear threats are continuously being made and where several red lines have already been crossed. So the likelihood of misinterpretations and miscalculations also increases. And these could lead to retaliation and, of course, to nuclear war. So if the threshold of a nuclear detonation is crossed, the risks of a rapid and large-scale escalation are extremely high. There are many things that can go wrong. And from a nuclear war, there is no turning back. Therefore, we must prevent what we cannot cure. Therefore, the time for abolition is now. It is urgent to delegitimize nuclear weapons and to take effective measures towards nuclear disarmament. It is urgent that decision makers be consistent with democratic and humanistic values, that public policy do what it's supposed to do, put people first. The antithesis of the existential threat of nuclear weapons is neither more nuclear weapons nor more threats. It is peace. And peace is not achieved by threats or impositions, but by building bridges and creating opportunities for cooperation, something that requires arduous and continuous diplomatic effort. The antithesis of nuclear weapons is multilateralism, and this multilateralism materialized in the TPNW. It is necessary once and for all to break this loop of complacency that has life on Earth under such a risk. Playing by the rules of the status quo has not worked. We need to change the status quo. That's why we are here. So policymakers, we are blessed to be here today with in the presence of several very responsible policymakers. We are lucky for you, and we thank you. And we understand that nuclear disarmament is certainly not an easy feat, but it is necessary, and more importantly, it is possible. And it must be the goal of every leader in the world. We, everyone, and especially the people in positions of power, must do absolutely everything we can to get there. Our future and our very survival depends on it. We have to give peace a chance. Thank you.
Thank you so much, Carlos, for those remarks. And I think now we can open the floor for questions to our wonderful panelists. Yes, please, the back.
I'd like to introduce the Santa Fe Archbishop. He has a few words to say. Very much grateful to you all and be here. Thank you for these wonderful work in New York Times. It's a Santa Fe, as you know, for the Los Alamos National Laboratory and some of the laboratories. And so, about a year and a half ago, we thought they passed the letter on the conversation on nuclear disarmament. So we were especially pleased because just last August we went to we met with Bishop Shirahama and Hiroshima, the Archbishop of Nura and Saki. And so the Archbishop of Seattle was there with us, all mentioned, and we formed our 4 dioceses to fund a partnership to work together and nuclear disarmament. Join us so that we can have a robust different world place in this party. So it's just an honor and a privilege to
Thank you for joining us, Bishop. And we have a question.
Sorry, quickly for tech, if you have a question, can you please come up here so they can hear you online? We have about 30 people joining us online. Sorry to make you, I'm putting you on the spot there.
And I think we had another hand here. So
yes, so for my question, it was kind of really about I was really moved to hear like the origins of your organization and how it was created by cross national solidarity with physicians, and that really persuaded the authorities at the time to understand the threat of nuclear war from another perspective. And so yeah, I'm just wondering how we could, I guess, how health professionals can really like bridge boundaries, from like national lines to really create that same solidarity to usher in like a new directive, like really create a new push for nuclear abolition.
Thank you.
yeah, Carlos, would you like to answer?
Yes, thank you. That's a great question. And in fact, what motivated the IPPNW founders back then was basically that they could meet as scientists. They could meet in scientific conferences. Why couldn't they just talk about peace? So that very powerful message is still very patent today. That is something that definitely we can and must use the language of science to promote scientific evidence, to promote the humanitarian impact of nuclear weapons, to promote the awareness of the humanitarian impact of nuclear weapons. It is very important that the people, when I say the people, I mean the general public, understand the risks, that they discuss the risks in their day-to-day, in their dinner tables, in the taverns. And that is where we come in. That is what we need to do, to communicate that. And also, of course, do political advocacy and convince our politicians with our scientific, with our evidence-based approach, that nuclear weapons are wrong and that they need to be abolished. And I will say that evidence-based policymaking, that concept comes from evidence-based medicine. So we were the pioneers of that, and we should continue to use that approach.
Thank you, Carlos. Yes, sir, please.
Thank you. My name is Todd Sack. I'm with Physicians for Social Responsibility in the U.S. And my question is for anyone on the panel: what can we do to get these topics into the curriculum of our professional schools, nurses, public health schools, and for physicians?
Veronique, yes.
So thank you very much for this very important question. I encourage you to perhaps to contact the American Red Cross, and I think that it will be a great way to engage the American Red Cross. They have a strong program of use, for example, of international humanitarian law. And this year the topic is nuclear weapon, and we are happy to say that they train like 40,000 young people across the US on IHL and nuclear weapon. But it would be great also to engage with the first responder, nurse, and medical student to work with the American Red Cross, because they will be the first responder. And I also wanted to mention that for the first time, the American Red Cross is joining the MSP2. So yeah, it's a very important development, and they are part of the International Federation of the Red Cross and Red Crescent Society. And there is the ICRC, but we have 8 colleagues from the Japanese Red Cross, from Central Asia, from Tajikistan, Kazakhstan, Kyrgyzstan, and Turkmenistan, and the American Red Cross and the Norwegian Red Cross with us. The Kazakhstan Red Crescent and Kyrgyz Red Crescent, Tajik Red Crescent, and Turkmenistan Red Crescent. I also wanted to mention for people interested, there is a discussion on an update of the WHO 1987 report on health effect. By the way, the title is on nuclear war, so it was not, in the mind already at that time, it was not on the use of one nuclear weapon, it was on nuclear war. And then there are discussions to update this study. So we hope that many medical students, researchers, scientists will work on this report. So encourage you to all to engage on this issue. Thanks.
Yes. We also have 2 participants online that have questions. Jill, maybe you can go first.
Yeah, hi. I was just going to actually speak to that question by one of the folks in the room. So the International Council of Nurses is developing a series of education modules right now. And one of our upcoming ones for this coming cycle is going to be disaster preparedness. And one of the units within that will be prevention of disasters, where we'll incorporate some education as well, not just on nuclear weapon disarmament, but also on issues such as climate change and other big things that prevent both natural and human-caused disasters. So please keep an eye out for them on our website, and we'll look forward to seeing you guys all engaging with that.
No, it's not you.
It's Michael.
Sorry, Jill, we lost you for the last 30 seconds, I think.
No worries. I'm not sure exactly where it cut off, but the International Council of Nurses has a series of education modules that we currently have live, but one of our ones upcoming for next year is disaster preparedness. And one of the units within that will be disaster prevention, which will include education materials for early career health professionals, specifically nurses, but it will be applicable to a lot of folks on nuclear weapon disarmament, and also issues like climate change and natural disasters and how we can prevent those as well.
Ana Maria?
Yes, thank you so much for the question. I would also like to share medical students' perspective on this, as we also participated in consultations recently with WHO on the Global Health and Peace Initiative, and we also here highlighted the importance of including peace and peace building within the medical education curricula. I think people started to understand the importance, especially after COVID-19, where medical students had to become frontline workers. And we were not equipped to do that. We didn't know how to do it. And sometimes I think it also produced more harm than help. But I think we can introduce it slowly. And what I mean here, IFMSA does a lot of capacity building initiatives on disaster medicine and humanitarian aid. And here I would like to highlight the importance of peer-to-peer education. So if one student goes to one of our workshops, they can give back to the community what they learn here. And also, I think we need to equip the medical students and our organizations, because IFMSA is made of approximately 140 national member organizations. We need to equip them on how to advocate for changes within their medical curricula, and including human rights education and peace building within this curricula. As I also said, that mainly it is based on disease-based learning. So I think it's very important for us to adapt to the new trends in global health and public health worldwide. Thank you so much.
Thank you so much for those remarks. I believe they're remarks, not really questions, but we have a question from Laz.
So I guess last point, my IPNW Germany. Just another comment on this question. I wonder if we, with our good context with the World Health Organization, sorry, the World, not the World Health Organization, World Medical Association, if we could get them to pass a kind of resolution to have a reference. I mean, because to include this kind of work into the academic world, we would need references to ask for that. And I think that might be an idea to think about.
Thank you for that, Laz. And I sure hope that gets to WMA. Carlos, I believe you wanted to add on to the question on the curriculum.
No, I did not. I just wanted to point out that that's what they were doing. But actually, I wanted Chuck to talk a little bit about a point he was making regarding bridge building amongst the scientific communities and how our organization is actually a bit of a testament to that.
Yeah, I just in that early question that you had about you know, the origins of IPPNW with U.S. and Soviet doctors getting together and understanding this threat, and they were meeting in cardiology meetings, they're meeting in scientific meetings, and we still have, in fact, we have 4 co-presidents. We have 2 of them here. We have Carlos. We also have Kati Juva from Finland right here. But we also have a Russian co-president, Olga Mironova, the granddaughter of the co-founder of IPPNW, Yevgeny Chazov, is a co-president. And even in this difficult circumstances that we have right now with Russia, we still have the dialogue going. But one of the things that would really that we really need to be working on, and that is we didn't have in the Cold War. We had these contacts that had built up through as the Cold War proceeded. With this current conflict in Ukraine, many of these scientific associations have decided to cut off Russians and Belarusians. And this is actually really problematic for the type of diplomacy that we need to be doing. For example, the US National Academy of Sciences has ceased to communicate with the Russian Academy of Sciences, even at a time when the Russian Academy was ready to do a joint statement urging the parties to avoid nuclear war. There was no interest on the American side. So I think those of us who have influence in those types of bodies need to be letting people know that cutting off these dialogues is the wrong way to go, and it's against what we believe in at IPPNW. So I just wanted to make that point. We're still trying to do this. It's a bit of a challenging situation currently, but hopefully we can get back into this type of multilateral exchanges. So thank you very much.
Any more questions? Oh, we have a question online from John. John?
Oh, John, and then there's also one in the chat.
My name is John Guilfoyle. I'm the president of IPPNW Canada. And I just, I've so enjoyed this gathering and want to thank IPPNW and Costa Rica particularly for hosting it. And I just wanted to just make a point and really ask a question as well, is that certainly we want to abolish nuclear weapons, but the pathway to that is not even defined. I mean, nuclear weapons are really the most egregious symptom of humanity's commitment to war. And unless we really remove war as an instrument of national sovereignty, the likelihood of getting to disarmament and removing nuclear weapons is maybe remote. So that's a big question. What is the pathway? What's the evidence? And what are the elements of that pathway that we as physicians and healthcare workers would promote? The other thing that I wanted to highlight was the role of nuclear power in facilitating nuclear weapons. I mean, the most important treaty at the moment that holds any sway with nuclear weapon states is the Non-Proliferation Treaty. It has 3 pillars. One is disarmament. That hasn't happened. The last 2 meetings did not end with any consensus. Number 2 is proliferation. And since the treaty was established, we've had at least 4 countries that have added themselves to the nuclear club. And there are many others, or not many, but at least some others who are getting closer. So pillar number 2 isn't working. Pillar number 3 is nuclear power and its peaceful use, which unfortunately aids and abets nuclear weapons. And the scientific community is examining the role of nuclear power in relationship to the other thing we need to link to this, which is climate crisis, and are coming up that maybe nuclear power is not all what the nuclear industry would have us believe. It was supposed to, according to Mr. Truman, give us power too cheap to meter, which went on to give us the hydrogen bomb. So we have to take a broader view of the challenges we face and wonder where nuclear power and what we should be saying to the world, and what is the evidence about nuclear power actually making the nuclear threat bigger. So those are some of the questions that I just wanted to pose. What should we be saying about nuclear power and its current, what some people consider greenwashing? So thank you very much.
Thank you for that question. Is there any other question online?
There's some in the chat, but maybe we answer them later, online later, since we're out of time.
Yeah. Okay, so I'll just very briefly address what the link between nuclear power and nuclear weapons. Of course, they're related. However, in the political arena, we do make a distinction. There are, for instance, many TPNW champion states who are also proud of their nuclear energy programs. So in that sense, it makes sense to separate the issues. However, they are, of course, related. Nuclear. If we talk from an evidence-based approach, what does the science say, and can we rely on nuclear energy? The science says that nuclear energy is expensive. The measurements, for instance, a levelized cost of energy, comparing nuclear energy to, for example, solar, makes it much more expensive. It is unsafe, as we're seeing right now in Ukraine with 15 nuclear reactors that are now vulnerable, that aside from all the vulnerabilities that they already had with to human error, to lack of human error, which was what caused the accident in Chernobyl, or the lack of external energy, because nuclear power plants, they produce energy, but paradoxically, they also need external energy. That's what happened with Fukushima, the lack of external energy that they need to function. Apart from that, those risks are heightened in the Ukraine. But now, the other risk that we have now is that nuclear power plants are a military target. So it's definitely not safe, it's expensive, and it also enables nuclear weapons because it's pretty much the same technology that is needed. We're seeing that we saw that with India and Pakistan, how they became nuclear weapon states after having their nuclear energy, and now Iran might actually obtain nuclear weapons from developing this. So it is definitely a longer topic than we have time for right now, but it is something that I would urge people to look very closely at the evidence and not the lobbying behind the claims that nuclear energy is green. And there is definitely a link. If the word nuclear didn't have that prestige, if nuclear weapons were not themselves a currency of power and calling themselves something nuclear was not prestigious, many countries would not have pursued this. It's what many people call the fig leaf of nuclear weapons, covering the shame of nuclear weapons, or even the consolation prize behind the NPT, the Nuclear Weapons Treaty. But that is a longer conversation.
Yes. Perhaps I would just say that from the International Committee of the Red Cross perspective, and it has always been our perspective. So we have a kind of double mandate. One is to protect and assist people in armed conflict, and the other one is the development of international humanitarian law. And since the beginning, we really need to stress that nuclear weapons are not some exceptional creation above and beyond the law. I mean, and then so the fact that like any other weapon, they are subject to the rules and principle of international humanitarian law, the principle of humanity, and the dictates of public conscience. And the ICRC, since the beginning, they said that it's very doubtful that any use of nuclear weapon will be compatible with international humanitarian law. So I think that it's really important that we also keep the focus on the humanitarian consequences of this weapon in all discourse, and to shift and focus on that and shift the narrative, and then talk of the humanitarian impact. And if we go back to the humanitarian impact, perhaps it will be also easier to pursue the conversation with nuclear weapon states and states that they are under nuclear umbrella. But I think that it's really important to continue the conversation on the humanitarian impact and the environmental impact of this weapon.
Thank you for those remarks.
Because I think that we need also to think in a way that the chemical weapon and the biological weapon, it's the same. I mean, the ICRC made the first call in 1919, sorry, at the end of World War I, and then the state, they couldn't agree to prohibit chemical weapons, so we ended up in a protocol in 1925, but it took like more than 50 years to prohibit biological weapon and then chemical weapon. But now it's a red line. You don't listen states that they will argue that we can use chemical weapon. But since World War I, it was not a taboo, and then states are using and stockpiling chemical weapons. So we really need to put everything in perspective and continue to argue that nuclear weapons need to be prohibited and eliminated as other chemical weapons. And the US and the Russian, they just destroyed their stockpile of chemical weapons last year. So it means that it's possible.
Thank you so much, Veronique. And I think we can go on this topic, but I'd like us to hear our closing remarks from Ambassador Chan before we
You're on the spot. Yeah, I won't hold you anymore. I think that today's discussion has been enlightening very interesting, and I have never seen an audience so engaged and so not afraid of coming to the podium and post your questions like yours. So it speaks volumes about how important is that the nature of the TPNW is open doors, and that we'll continue to do this, to sit down with the medical community, with the experts, with the nurses, with the first responders, and to hear your feedback, because we are leaving this meeting, at least I am, with more information, with more insight, and with a renewed commitment to continue to support nuclear disarmament. And you that come from countries that are nuclear armed states, please mobilize your own communities, your own parishes, your own civil society, because these weapons could be affecting you directly, and have these devastating consequences. And as Carlos said at the beginning, they are intended for civilians. They're not intended for combatants, and that is terrifying. It speaks about how we dismiss human life and human value to a point that we are no longer guided by principles like interest. And this is not the kind of world I want to live in. So as a country that relies only on international law for its defense, why we cannot all do the same? But as long as the currency and the legitimacy resides on a weapon that is unethical and moral and humane, we should really have this conversation when it matters, and it's in your own communities and perception of what is power, what is status, and what is legitimacy. So thank you all. It's been a pleasure.
Allow me to thank our speakers for a very thought-provoking discussion, and for all you guys for attending this session. We appreciate. History has shown us the implications of nuclear weapons, and I hope that we leave with strong affirmation that we do not want this now, no more, no more, not now, and not ever.